Open surgery is traditionally cutting open the patient and removing and reconstructing what you have to accomplish the surgery. Laparoscopic is doing the same thing by making small puncture wounds and placing instruments within the abdomen where we operate and doing the same surgery. Robotic took the standard laparoscopy to another step, another paradigm, where we were able to do far more complex surgeries robotically that we never could do laparoscopically, because you had full degrees of freedom within the abdomen, within the instrumentation, and the ability to do things much more complex, much more efficiently, and with better outcomes than we ever could with the limited degrees of freedom of laparoscopy.
The most basic form of surgery, what's been done for hundreds of years, was open surgery. This is the way all of us trained to initially learn to do the vast majority of what we do in the field of urology and in general surgery. Within the last 20 to 30 years, we've seen the advent of more minimally invasive techniques to accomplish the same kinds of surgery. The first development was laparoscopic surgery. This involves the use of endoscopic instruments that were controlled by the surgeon's hands. While this was a major leap in the delivery of minimally invasive care, it was a small leap in comparison to the jump that was made with robotic surgery. It's important when you speak about robotic surgery to understand that there have been multiple surgical robots over the last 10 to 20 years, but it really wasn't until the development of the intuitive product, the Da Vinci robot, that we had this massive jump forward in our intracorporeal capabilities. Specifically, the jump that occurred from laparoscopic surgery to robotic surgery was the development of the endo-wrist technology. This took the degrees of freedom from a laparoscopic surgeon up to the degrees of freedom of an open surgeon, but now within the body. The endo-wrist allows us to complete maneuvers robotically that could not be completed laparoscopically.